In this section, we will talk about the renal failure, its types, and their causes. Renal failure refers to failure of excretory functions of kidney. It is usually characterized by decrease in glomerular filtration rate, or GFR. So, glomerular filtration rate is considered as the best index of renal failure. However, decrease in glomerular filtration rate is not affected much during the initial stages of renal failure. If 50% of the nephrons are affected, glomerular filtration rate decreases only by 20% to 30%. It is because of the compensatory mechanism by the unaffected nephrons. The renal failure may be either acute or chronic. Renal failure is always accompanied by other complications such as deficiency of calcitriol or activated vitamin D, resulting in reduction of calcium absorption from intestine, and hypocalcemia. Deficiency of calcitriol and hypocalcemia may cause secondary hyperparathyroidism in some patients. Second is deficiency of erythropoietin, resulting in anemia. Third is disturbances in acid-base balance. Now let's discuss the acute renal failure, along with its causes and features. Acute renal failure is the abrupt or sudden stoppage of renal functions. It is often reversible within few days to few weeks. Acute renal failure may result in sudden life-threatening reactions in the body, with the need for emergency treatment. Now, what are the causes of acute renal failure? Let's discuss them. Acute nephritis, or inflammation of kidneys, which usually develops by immune reaction. Second is damage of renal tissues by poisons like lead, mercury, and carbon tetrachloride. Third is renal ischemia, which develops during circulatory shock. Fourth cause is acute tubular necrosis, or necrosis of tubular cells in kidney, caused by burns, hemorrhage, snake bite, toxins like insecticides, heavy metals, and carbon tetrachloride, and drugs like diuretics, aminoglycosides, and platinum derivatives. Fifth cause is severe transfusion reactions. Sixth cause is sudden fall in blood pressure during hemorrhage, diarrhea, severe burns, and cholera. Seventh is blockage of ureter due to the formation of calculi or renal stone or tumor. Moving towards the feature of acute renal failure, they are oliguria, which is the decreased urinary output, anuria, which is cessation of urine formation in severe cases, proteinuria, which is appearance of proteins in urine, including albuminuria, means excretion of albumin in urine, hematuria, which is the presence of blood in urine, edema, due to increased volume of extracellular fluid caused by retention of sodium and water, hypertension within few days because of increased extracellular fluid volume, acidosis, due to the retention of metabolic end products, and coma, due to severe acidosis, if the patient is not treated in time, resulting in death within 10 to 14 days. Moving towards second type of renal failure, and that's the chronic renal failure. Chronic renal failure is the progressive, long-standing, and irreversible impairment of renal functions. When some of the nephrons lose the function, the unaffected nephrons can compensate it. However, when more and more nephrons start losing the function over the months or years, the compensatory mechanism fails, and chronic renal failure develops. Moving towards the causes of chronic renal failure, which are chronic nephritis, polycystic kidney disease, renal calculi or kidney stones, urethral constriction, hypertension, atherosclerosis, and the tuberculosis, and slow poisoning by drugs or metals. Moving towards the features of chronic renal failure. First is the uremia. Uremia is the condition characterized by excess accumulation of end products of protein metabolism, such as urea, nitrogen, and creatinine in blood. There is also accumulation of some toxic substances, like organic acids and phenols. Uremia occurs because of the failure of kidney to excrete the metabolic end products and toxic substances. Common features of uremia are anorexia or loss of appetite, lethargy, drowsiness, nausea and vomiting, pigmentation of skin, muscular twitching, tetany and convulsion, confusion and mental deterioration, and coma. Second feature of chronic renal failure is the acidosis. Uremia results in acidosis, which leads to coma and death. Third feature of chronic renal failure is edema. Failure of kidney to excrete sodium and electrolytes causes increase in extracellular fluid volume, resulting in development of edema. Fourth feature of chronic renal failure is blood loss. Gastrointestinal bleeding, accompanied by platelet dysfunction, leads to heavy loss of blood. Fifth feature of chronic renal failure is anemia. Since erythropoietin is not secreted in the kidney during renal failure, the production of red blood cells decreases, resulting in normocytic normochromic anemia. Sixth feature of chronic renal failure is hyperparathyroidism. Secondary hyperparathyroidism is developed due to the deficiency of calcitriol or 1,25-dihydroxycholecalciferol. It increases the removal of calcium from bones, resulting in osteomalacia. This was all about this section. In our next section, we will talk about the dialysis and artificial kidney.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.